So let's start with this. Um, so today we're going to be talking the basics about stem cells. What is a stem cells? The types of stem cells out there. How does the body naturally heals? We are also going to be talking about what is a stem cell therapy and the risk and secondary effects of stem cell therapy, some myths of stem cells, and the current therapies available on the market today. Uh, so let's start with the basic. The basic structure or functional body would be a cell. So many cells form a tissue. Many tissues forms organs. Many organs are the ones that form a system, and many systems will form a body. When I mean systems, I'm talking about the circulatory system, for example. So what I want to show over here is that the cell is the minimum structure with functionality. So there are two types of cells in our body, the ones that are mature and the ones that are not. The mature cells has already specific function depending on the organ or the tissue where it belongs. That means that an cell in the lung will work as a lung cell. A mature cell could duplicate or replicate, but it's very limited on the number of times that it can be replicated. So if we have a skin cell, that mature cell maybe will give birth to another cell, but maybe one or two. What is a stem cell? The stem cell is a master master cell where is capable of reproducing itself many times and produce identical properties of the original. So we have one cell that is going to be duplicate and form another cell with the same characteristics. Also, a stem cell is capable of differentiation into another kind of cell. That is, that this stem cell gives birth to another cell, and that one could redifferentiate into blood cell. In this case, on the picture I show a blood cell, that it will become a red cell, white cell, or platelet. And the third characteristic of a stem cell is the homing capability. This homing capability means that this cell could detect damaged tissue and change the location in the body to get to that specific damaged tissue. So they can travel inside the body. Um, okay, so how does a body naturally heals? So we have a balance in our life where mature cells are dying all the time and new cells are growing all the time. So first, the stem cell is born and it travels to the tissue that it's going to be working on. Then it differentiates into that type of tissue and becomes a tissue cell, a mature cell. And when that mature cell dies, then it's discarded and then a new cell replaces it. It's a continuous production of stem cells. I mean, if we have like a skin cell and one of our skin cell it dies, it will just be discarded by the body, and a new cell below it will emerge, and that new one it will most likely comes from another stem cell below it. When we are out of balance, that means that our cells are getting damaged very rapidly, and that could be many reasons for that. It could be a disease, it can be an accident, it can be in many different ways, but the body does not release enough stem cells to repair that damage. Therefore, there is no balance on the dead cells and the new cells. And if the dead cells are getting damaged faster, then it becomes a chronic disease, or it can be an injury that cannot be healed just naturally. That's where some cells comes in for therapy. Now we can divide the stem cells into different types. I'm just going to put two examples of this. So when you divide a group of stem cells by source, you have to talk about the embryonic group and the adult stem cell group. The embryonic stem cell, they are located inside a blastocyte or embryo, yeah, up to 8 weeks of fertilization. That means that in order to take an embryonic stem cell, we have to kill the blastocyst. Now you have adult stem cells, and the adult stem cell, they are cells that are not embryonic. They are, it can be in a baby, but they are fully mature or fully grown, so that's why they're not called embryonic. And those adult stem cells are located all over the body, but on every organ. They have we have concentrations in only a few parts of the body, and that would be the cord blood when a baby is born, a placenta, or the fat tissue, or the bone marrow. Those are the main sources of stem cells. We're going to talk a little bit more about these types in a little while. The stem cells can also be grouped by their potential. So there are totipotent cells, or stem cells, and those are the ones that could grow and form a complete new organism. So when this cell can grow any type of the cells in the body, they call it totipotent, everything. Pluripotent, that would be a cell that could become any other kind of cell, but not all of them. Multipotent are the ones that could differentiate only into the same cell line. So I was talking about stem cells from blood. They're called hematopoietic stem cells. So that those are multipotent because they can only become the same line, red cells, white cells, and platelets. And if they would be pluripotent, they can come other cells other than their line. And unipotent, that would be the ones that can form only one type of cell, meaning the skin cells can only produce another skin cell. Now, why are the embryonic stem cells are so controversial? Embryonic stem cells have very good things and some bad. The very good things about it is that they're very easy to duplicate. They can unlimited can duplicate themselves, and they are totally potent. They can be differentiated into any kind of tissue in the body. So this is so, they have so much potential that they're very interested to be studied and to use them. Now there are some problems to use them, and the first problem comes when you want to acquire them, to take them from the source. You have to take it from an embryo or from a blastocyst. Then you have, they're totally potent since they can become any type of tissue. They could grow some tissue on unwanted locations. That would be like growing muscle inside a vessel, and maybe you don't want that. They are highly prolific, so they have the risk of multiplicating too fast into other kind of tissue, and they can form teratomas or the cancer, or they can grow in different sizes and shapes that you don't want to have them. Then the other problem using embryonic stem cells is that they would transfer between donor to the recipient any gene information, any genetic information. So the more information, if there's a disease that in the donor it haven't show up because they don't have the same agents that will launch that disease, then maybe in the recipient it will. And they also have legal issues because of all this. So in almost every country, they are illegal. The way to get an embryonic stem cell would be from an egg or already fertilized. It forms the blastocyst, and then the inner mass of that blastocyst, they will come to a petri dish, and there they will cultivate it or duplicate it to be used. But the source it's always the same one. It would have to be blastocyst. Now, an adult stem cells compared to a mature stem cell, they also have pros and cons. The good thing about them is that they're highly prolific. They can multiplicate very easy, not as easy as the embryonic, but they grow fast. Also, they are pluripotent, meaning, or multipotent, mean that because they're primitive cells, they can differentiate into different kind of tissues, many of them. They have easier access. In order to get a stem cell, you don't have to go to a blastocyst. There are concentrations in the body that you can take it from. You have the cons, that they have a limited proliferation, meaning that there are limited times that the cells can duplicate itself, and therefore they have some limited potential at some point. And the second problem is that since we have concentration of those stem cells in the body, they're not unlimited. So in order to acquire them or to take them, there is a limited amount that you can take. Here is a bone, and inside the bone, where the bone marrow is. On this area, on the spongy side, that's where we take the bone marrow to harvest the stem cells. And over here on the picture, we can see that there are different type of stem cells inside the bone marrow. We have the hematopoietic stem cell, and those are the ones that are multipotent to create blood forming cells. And so you can get red cells, platelets, neutrophils, and so on. Then you also have a little bit lower on the screen, you will have stromal stem cells, and those cells are also they will be able to differentiate into bone or cartilage, and there are other type of growth factors in the bone marrow too. So the source, it's very rich on growth factors and stem cells. What is stem cell therapy? Nowadays, we can hear that in many different areas, and everyone that is using a stem cell to treat a medical condition, it's being called stem cell therapy. Now, there's a difference between stem cell therapies, and the first question that I get a lot is if this is an infusion or a transplant. I just want to make the difference, because an infusion, it would be adding to your body, and it will reinforce your current tissues or systems. It would increase or reinforce your immunologic system, neurologic, metabolic system, where a transplant is replacing an organ. So, if someone needs a bone marrow transplant, it usually will involve getting a donor. For that donor to acquire the cells after harvesting them, they will have to process them or store them, transport it to the recipient, and the recipient will have to have an aggressive type of procedure in order to take the organ out. Let's call it chemotherapy, radiation, to take out the bone marrow and replace with a new bone marrow. So the difference are huge. They're used in a very different way in different medical conditions. Infusion would be used to reinforce your body and to help the naturally healing process, while transplant would be to replace a damaged organ completely. There are types of transplants. The autologous are the ones that the donor and the recipient are the same person. The homologous or allogenic are the ones that are from one person to another person. different donor and different recipient. And the heterologous are the ones that are from different species, let's say from a pig to a human. And I just wanted to go through this because there are some risks involved in this, especially the safest one is the autologous, and I'm going to go into that. The risk and secondary effects of a stem cell therapy infusion or transplant or any type of transplant. If you are using the same donor and the recipient, that's the autologous, there is no risk of rejection. There's no risks involved more than an infection, more than the bruise of the skin where the needles goes in and goes out. There's actually maybe 5% of the patient that they say that they develop a headache, but other than that, there are no secondary effects or big risks into it. Now, the allogenic ones, where one human is donating the bone marrow to another or another type of organ, there are some risk involved, like the infection as above, but also the gene disease transmission. It can also be low viability of the cells if they're not stored and processed properly. There could be tissue rejection, and in tissue rejection, it would could develop a graft versus host disease that it could be fatal if not treated properly. So there are very high risks on doing allogenic transfusions or infusion or transplants, and also they vary between person to person. So it can have complications, and those complications can get even worse. We want to just note that it's more aggressive, the risk and the complication, the more different the tissue is. So if we're doing a transplant between an animal and a person, then the aggression of the secondary effects could be terrible. Uh, there's some questions of people that ask me, and or people that says things that we don't agree at all. And I want to go to a few of them, the most common ones. The people tell me that in the near future stem cells will cure everyone and will cure all, and that's not true. It is for selected patients because there are some diseases that the stem cells are not capable to regenerate, or if we have a patient that it's in a very bad shape for some reason and the bone marrow is not healthy, then it's going to be very difficult for those stem cells to cure that person. Now, stem cells cause teratomas or cancer. That's not true. When you are using a reliable source of stem cells, you don't have that risk. If you are using embryonic stem cells, you have a very high risk of this. So not all stem cells are created equal. Stem cells from your own body cannot treat your own illness. That's not true also, because if you take bone marrow from a healthy person and that has a healthy bone marrow, and he has another issue like uh, heart disease, that heart is the one where the problem is, but not on the bone marrow. So you can take those stem cells from that healthy bone marrow and treat your own illness. All stem cells are illegal, as we said before, only the ones that are embryonic. Stem cell therapies are super expensive, and they were in the past, and now it's getting much more accessible. I've seen some places where they have procedures from $5,000 all the way to $15,000. Stem cells from shark cartilage are much better because sharks, they don't get sick. I heard that many times, and well, that's not true. I would be very scared of having stem cells from shark into my body because the rejection could be fatal. Now, stem cells from placenta or fat have 10 times the number of cells compared to bone marrow or umbilical cord. And that's also not true They have 10 times maybe the number of cells, but not the number of stem cells. Placental fat has a lot of liposomes that they're very much confused with true stem cells. But the true stem cells, the one that are going to work for that person, they are kind of the same in umbilical cord, bone marrow, and fat. Uh, what are the conditions that are being treated today with stem cells? I've divided them into different groups. The immunological type of conditions would be arthritis, fibromyalgia, lupus, asthma, and there are some others. It's being very successful in immunological diseases. In metabolic diseases, we're talking about diabetes with heart insufficiency, renal insufficiency, liver problems. If those organs are not 100% working with stem cells, they can regenerate tissue, and with this type of conditions, stem cells have shown a lot of improvement. So that's very good, a very good group to use stem cells to. Neurodegenerative diseases, there are some people treating MS, Parkinson's, Alzheimer with this type of stem cells, but on those we have seen good results, but not as fast as we can see them in the immunological or metabolic group. The neurodegenerative, they do improve, but very slowly. With the eyes problems, we have maculopathy, diabetic retinopathy, optic nerve atrophy. We have patients that have come to our clinic with very bad shape. They couldn't see. They see just some shadows. And after 2 or 3 procedures, they are able to be driving and riding a bike today. So there are also a huge potential on this. There are also clinics using it for pediatric type of cases like muscular dystrophia, immunologic conditions, neurologic like autism and cerebral palsy, and with very good results. Children do react much better and faster to stem cell therapy than adults. Looks like the bone marrow of a child, it's more and more active. Then healthy aging, it's also a group of people where if they are healthy and they want to do stem cell therapy, those cells are going to travel into the body. They will look for damaged tissue or organs that are not 100% working, and they are going to regenerate those organs. So when people ask me with an anti-aging or healthy aging procedure, are they going to look younger? Actually, for the skin, it's not gonna do like a facelift, but they're gonna feel from the inside out very good. They're gonna feel with more energy. They're gonna feel some benefits. The face, the and the some people have tell me on these anti-aging procedures that the skin has also improved, and the hair growth have improved, and the nail growth they're also in a better shape. So this anti-aging group could grow faster and faster. For the aesthetics side of medicine, they're using it for facelift and for hair growth. That's still being on research, but there are some clinics offering also that. What are the trends? The trends are that bone marrow stem cells, it's been there for a few years and it's going to continue to grow. It's being huge and it's growing every day. Cord blood stem cells are still being studied. They're not so regulated, and they have their consequences because of being allogenic. But because they are very potential, they are still being studied to have some treatments around it. And not many people are using those still. Fat tissue, it's a growing interest because it's easy to be provided in a doctor's office, and it's used in aesthetics. So it's growing the interest of many doctors, and there's a lot of research over there, but they haven't shown better results than bone marrow for immunological conditions, for example. Now, for embryonic stem cells, they're definitely something to take a look at because they're huge, they have huge potential, but it's going to take even longer than we thought to be useful in the market. They're not there yet, they're illegal, and they have some issues to be solved by the research group. How is a procedure of stem cell therapy done? The first step, it would be to have a consultation with the doctor, a blood work, the specialist. It's going to be they're going to study your case, and then there's going to be a patient preparation. Let's say with some vitamins or some habits or some stopping some kind of medication in order to get a healthy bone marrow. Then the procedure, the day of the procedure, it would be aspirated bone marrow with local anesthesia so it doesn't hurt. I will show you some pictures right now after this. After the aspiration, they do the preparation of the cells. Either they dilute it or they concentrate it depending on the condition that they're treating. Then they infuse the cells by IV or by catheterism to get it inside the body. And also, depending on the condition that they're treating, they can do direct injections to the organs. So, the lumbar injection to the joints, to their eyes, thyroid. It depends what the treatment is about. But after being the procedure, the patient will go into recovery or observation after the procedure just to make sure there's no reaction. It's usually done in a day. I mean, usually people coming from far away, they take a 3 day, 2 night trip, but some people also come for one day, just come in the morning and go in the afternoon. But it depends on the case. Here are some questions. If you don't like blood, give me just 1 minute and come back later. I'm going to show you just how the aspiration is done. And you can see that the needle goes into the bone, to the spongy area, and that's where they take the bone marrow. And here is a leg where they cleaning to put the needle in. Um, they can also be aspirated from the tibia bone. Here is the needle inside all the way to the bone. It really looks like very painful, but it's not. It has local anesthesia. And here's the aspiration of the bone marrow. As you can see, it looks like blood, just a little bit clearer. It has more fatty tissue. After the having it, there is a process to dilute it or to concentrate it, and here is the infusion by IV. After the blood goes into the body, it will run into different kind of organs, and where it finds the damaged tissue, it will engraft there and start the process of duplication. So if someone, sorry, if someone is interested in going into treatment, this is the steps that they're gonna follow. First, they're gonna study the condition of that patient. Then a medical team will determine the best therapy for that specific person. Then there's gonna be like a coordination and scheduling process where they're gonna set a date. They're gonna plan the transportation, meal programs, or any type of nutrition that it has to be done. Then the patient will travel with the support of the clinic, and the procedure will be done. And there's going to be a very important stage, the follow up. It would measure and evaluate the progress of the patient, and it will answer all the questions that that patient has. So the follow-up is very important. I want to finish with some experience about the clinic that I work on. It's ProgenCell. ProgenCell is a clinic performing safe stem cell therapies because we are using only autologous type of stem cells. Remember, same donor, same recipient. There is no complications on any of our patients up to date. So that's very good. In other words, ProgenCell will provide patients with an outpatient treatment to improve their health condition by auto infusion of stem cells obtained from bone marrow. Is the most powerful, practical, and cost effective to do stem cell therapy. Um, we have done more than 600 treatments, more by now. There are no complication. It is very, very safe. All cases have had improvements, maybe 50% of them excellent results. They are having a huge quality of life. On the rest of them, they will have some improvement, but I cannot say they are excellent. Uh, and there's only one case that we had a bad result because of an external factor. So it was not a problem of the procedure or our clinic. It was more about some factors on that specific patient. Whoever's interested in this case, I would be happy to talk about it. Now, factors influencing the outcome. A patient will have better results if the bone marrow condition is very good. If the bone marrow has a problem, then most likely it won't be able to be used, and the outcomes are not going to be very, very good. If the disease has been there for many, many years, then it's going to be a patient harder, or it will take longer for the stem cells to treat that condition. If there are multiple conditions present, let's say if they have a problem with the heart, with the liver, and with the kidney, that patient will have a worse outcome than if a patient that comes with only a heart disease or only the liver insufficiency. The last factor that influence the outcome, it would be harmful habits of smoking, drinking, drugs, etc. Those are much more the let's say the fertilizer of the earth won't grow as many nice flowers as a better body that is well treated. In ProgenCell, we have a medical committee. This medical committee will review the cases and will support the operation depending on the condition. We have orthopedics, cardiology, neurology, depending on the patient. That's who the specialty of the doctor will come handy. The first two doctors are the doctors that perform the procedure. Dr. Luis Romero is the one standing up. Dr. Jorge Luis Gaviño is the one sitting down in the picture. So those are the two main doctors that perform the stem cell therapy at ProgenCell. Here are the doctors again, and we have other people of the team. If you want to put a face in the voice that you are hearing, I'm the one in the middle. So this handsome guy over here is the one talking to you right now. The facilities, it's very important to have clean facilities and with a surgery room that it's sterile so you can prevent any kind of risk or of infection. And the facilities at ProgenCell are located in the border of USA and Mexico in the Tijuana side. Very pretty, very clean, very well oriented for our stem cell therapy that we do. So to finish this presentation, I would just want to conclude that stem cell therapy is effective for selected cases, is not for everyone, and can't cure all. There are some cases that have turned down because it's not for everyone. It's a new perspective in medicine. Definitely, it's very new. So there's a lot of research being done. People say that this is just the beginning of an iceberg. So it's a very new perspective. Then the treatment has a scientific base. It's not something that one day one doctor just start experimenting. It has a very solid scientific base. It's a possible hope for diseases that today doesn't have a cure, doesn't have that has only medication. That once that you have that medication, you're damaging maybe another organ. So this is a very good hope for all those kinds of conditions. And it's definitely a promising future, this stem cell therapy. So I want to finish now to open the audience for some questions. I don't want to hold you more. If you want to ask a question, you go to your control panel, and at the end, there's the questions box, and you can put your questions over there. I'll be happy to answer them. If someone is shy and doesn't want to do the question right now, here is our email address. You can email us. You can see our webpage. You can call us, and I will be happy to answer any questions that you have. Um, so let me go to some questions that I'm receiving from people. Here is a question saying, is the procedure or treatment has to be repeated more than once? Yes, the answer is that we have seen better results when the treatment is repeated a few times. Most of our patients come 2 times or 3 times for a procedure, and that's where they get better results. Some people get very well with one, but the doctors would like to see them several times. Uh, have you done any procedures addressing pulmonary distress issues like COPD? Yes, we have treated people with COPD with very good results. What happens there is that the first place that the stem cells are going to go is the lungs. They will go into the IV, and then they will go to the heart and to the lungs, and they will filter over there. So if they find damage over there, they will engraft and they will start working. And so yes, we have good results. Obviously, it depends on every patient. It depends on how bad the COPD is. So the best way to move forward is to have an evaluation of your case. Then we have another question. What about wet macular degeneration? Currently receiving Lucentis shots. Okay, so we on the macular degeneration, we have had very good results. Actually, retinitis and macular degeneration are the best cases that we have. The way it works, after doing the aspiration of the bone marrow, they will take some of that bone marrow and concentrate it in a very small volume, maybe 1 milliliter, 1 mil or 2 milliliters, and those that amount of volume, it will be injected behind the eye. We call it retrobulbar injection. The patients that have come, they say that it's not painful at all. It doesn't they feel like a little pressure, but it's very tolerable. And after the second procedure, after a few weeks, people are calling us that they're very happy because they can do so many things after having that improvements. They're very happy about it. So macular degeneration is definitely one of the procedures that it works very good. We have another question about here about let me read it, kind of long. 1 second. Okay. It's saying if this procedure works well for heart problems, and which heart problems. Okay, I want to be clear that, as I was saying before, not all the procedures are good for everyone. Heart problems that are related to of malfunction of the valve or if you needed a stent in order to take cholesterol out of the way, then those are the things that the stem cells don't work that well. They work well when there is like muscle that it was dead, and that muscle needs to improve their function. So they call it ejection vascular fraction. That's one of the best way to improve it. What if a scar tissue has formed in eye with macular degeneration? Does the stem cell work for that? We have seen on many organs that once that the scar is there, the stem cells are not going to dissolve that scar, or they will not repair this scar. But wherever there's a scar, the surrounding tissue of the scar, it's the one that it can be improved with stem cell. That way it improves the function, but it will not cure or take out the scar. That's the honest answer. Does stem cell work on spinal cord injuries? And I'm going to be answering this, going to be the last question. If someone has another question, be free to send it to my email. I don't want to have you much more time on this. But let me answer. The spinal cord injuries, it will depend on the level of the injury, if it's on the lumbar area or we're talking about the cervical. And we also have to be looking if it's a mechanical problem or a nerve problem. So if it's mechanical that needs surgery, the stem cells will not repair the disalignment of bones. The stem cells are not going to be able to take out the pressure of a nerve. But if there was damage to the nerve after an injury and they went into surgery, and now the spine it's aligned, then the damage on that nerve that could be addressed. That could have a special lumbar injection to go there and try to repair it. Also, it depends on the factors that I told you about. If it's a recent injury, it has more possibility of improvement than an old injury. So once again, the best way to proceed on spinal cord injury or any other type of condition would be to fill out a medical questionnaire that we can send you by email without any cost, and we can evaluate your case, or send us your medical records to this email, and we'll be happy to follow up with you, answer all your questions, evaluate your case, talk to the doctor. You're able to talk to the doctor directly, so they can answer all your questions and see how can we improve your quality of life. Well, thank you very much for being here. Thank you very much for staying with me. Next month, I'll be doing another seminar. It's going to be same subject, but it's going to be deeper on the how the procedure is done, more pictures, how it's actually the active process of generation of tissue in some organs. So look at our website next month, and you'll be well. They're not the specific dates there yet, but they're gonna be there soon. So come back to our website and visit us. Okay, drop us a line to this email to see how we're doing, and we'll be happy to answer you. Okay, well, have a good day. Thank you for being here.